Well, the Andrews government is significantly underreporting the number of COVID patients in intensive care in its official statistics. According to secret data obtained by the Age newspaper, there were 181 COVID patients in ICU beds in Victoria yesterday, way more than the 114 patients reported by the Victorian Department of Health. Why is that? Because the Health Department considers patients COVID cleared if they've been in hospital for 20 days and no longer need to be placed in an isolation ward. That's despite some of these gravely ill patients still needing weeks of ongoing care in ICU. Shadow Health Minister Georgie Crozier, a former nurse, joins me now from Melbourne to weigh in on this issue. The discrepancy, look, I'll get to the accounting trickery because that's all this is in a moment, but how concerned are you about the real intensive care numbers in Victoria?
Oh, Peter, I think every Victorian is really concerned about the numbers of people in intensive care and our intensive care capacity. Daniel Andrews last April promised Victorians that there'd be 4,000 extra ICU beds. And of course, we know that hasn't been delivered. Far from it, there was a $1.3 billion spend on that, and we don't know where that money's gone. But what we do know is that there is less than 500 intensive care beds operating in Victoria. So it is enormously concerning that we've got this incapacity to be able to manage what is going on. And as you've pointed out, why are they fudging the figures here? Why are they hiding this data? How can we trust this government if they're not being upfront and reporting it like other states are to the national authority?
But this is the latest example of an ongoing story, Georgie, out of Victoria, where there's a secret report. There was secret data on suicides and the mental health impacts of young people exposed by the Australian newspaper. You've got this data set about ICU beds. It's different than how it's reported in other states. Why is Victoria so secretive on all of this information, which should be in the public domain?
Of course it should. I mean, everything that you've just said is there to see. And Victorians can say it's just a secretive government that is refusing to release the health advice around the health orders of why the government has put the harshest restrictions relating to COVID of anywhere in the country. I mean, we've had the worst outcomes. It's been horrendous, as you well know. And this government is just so incredibly secretive, whether it's this data or other data, even with the performance data released today, which goes to the heart of elective surgery wait list numbers and performance data around ambulance response times. Well, they haven't even put up the specialist appointment times. Those wait times, they just continue to sort of change the goalposts, and therefore they get away with it. It's part of their way that they operate. It's more about media management than actually being upfront and providing the data and the critical information that I think every Victorian deserves to understand exactly the capacity of our health system.
Let's go to those elective waiting lists. You made that point. Let's bring them up there. AMA reports out today huge waiting lists, not just in Victoria, around the country, public hospitals. But in Victoria, the problem obviously is a lot worse than elsewhere, and it's got worse over the last year than before. In June, there were some 66,000 Victorians waiting for surgery, 10,000 more than in June 2020. That's a concern, Georgie. I listened to Neil Mitchell's radio program this morning on 3AW, and there was surgeons calling in, really angry. One of them was on a golf course because he couldn't do surgery at the private hospital that had been cleared out for public patients, very little public patients in there, and people on waiting lists in quite significant pain, also calling in, unable to have their hip replacement and other surgeries booked in that got pushed out because of this latest spike in ICU beds.
Well, exactly. We've got, before even the suspension of surgery in March last year, in lockdown 1, we had record numbers of Victorians on that elective surgery wait list. Of course, it's got worse over the last 18 months because the government has not prepared our health system to the extent that they should have. It's years of underinvestment. And if you think about it, the Premier, who was the Health Minister and Premier for 11 of the last 15 years, has an enormous amount to answer for, I think. Today they've put a Band-Aid measure on, but these numbers are increasing. And those surgeons that were ringing in today who are so frustrated that they can't operate on their patients. There are beds that are sitting empty. There are hospitals that can't undertake these operations. People are waiting in pain. They're not, these aren't cosmetic surgery. This is vital surgery. It's hips, knees, heart valves, cataracts. This is really vital surgery that are going to improve people's quality of life. But while they're waiting on these wait lists, on the public and now private wait lists, you're going to get more people with increasingly worse medical conditions, or their medical conditions worsening, I should say, and that's going to put their health and wellbeing at risk. And I don't think that's acceptable at all when the government has got no answers to this crisis, and they can't even say to these surgeons, yes, we're going, we're starting to ease up on this, and we're starting to get the elective surgery back up and running. So it's really, I think, incredibly concerning for all Victorians that this crisis is to the extent it is. You've heard the AMA and others talk about it. It's just not me. It's these surgeons that are saying we're in real trouble here, and these patients are the ones that are going to be the losers in all of this.